Okay, this video is very important. I'm Dr. Shelley with HETV, Health Education Television. This video is the benefits to mom, breastfeeding. Now, the deal is, you know that you have to pass this test, but this video is for everybody. And so this is talking a little bit about some of the baby-friendly initiatives and how the breastfeeding affects mom and how it's beneficial to mom. But real quick, here's the answers to the quiz that you took. Are you ready? Now, so the answers to the quiz that you took, and by the way, we do have, I believe we have maybe one winner. You guys didn't do too good on this. We also had a winner for the other quiz. So watch this. What are the contraindications to breastfeeding? Maternal contraindications, maternal. Here you go, chemo. There's no way, it's not negotiable, there's no way you can breastfeed and be on chemo. Zero, zip, not gonna happen. Smoking pot is not a contraindication. Listen to this. There's only 4 contraindications, real contraindications to breastfeeding. Smoking pot is not one of them. Chemo is one. Positive HIV, I think everybody got that right, is a contraindication to breastfeeding. Radiation therapy for cancer, yes, any radiation is a contraindication to breastfeeding. So you're not going to get a mammogram if you're breastfeeding. All right. Substance abuse, yes, heroin, cocaine, crystal meth, whatever, is a contraindication to breastfeeding. You might be saying, but Shelley, smoking pot, alcohol, vaping, and a person with cancer, they can't breastfeed. Actually, they can. What I know, and you know, and we all should know, is that there are plenty of people who do some of these things or have some of these situations. And if you all of a sudden wanted to just be a, absolutist and say that's no alcohol, no cigarettes, no marijuana, no nothing, can this woman breastfeed? Then that's stupid. Because for one thing, yes, tobacco, yes, nicotine, yes, marijuana, and yes, alcohol crosses the breast milk. It does. But we're always looking at benefit versus risk. And the benefits of breastfeeding far outweigh the risk of the crossing into the breast milk of these substances. And we know also that if patients are on any of these substances, while we would love for them not to use any, like 0, like that's best for mom and baby, even the alcohol, it's best, right? But we also know there are ways to work in breastfeeding when a mom is trying her best to do what she feels is best for her baby and herself without saying, oh, you smoke, you can't breastfeed, because it's all bullshit. So if you are a smoker, if you are someone who smokes pot, we tell our patients to please stop. But if you haven't stopped, then if you're going to do this, the best time to do this is after you just nursed, not before. You see what I'm saying? The quantity of crossing the breast milk, you see that? Okay. That's true for alcohol. That's true for a lot. Considering the fact that we know it's not best, but I didn't ask you what was best. I asked you what was contraindicated, and these things are not contraindicated. Cancer is not contraindicated either. I know plenty of people who had cancer that breastfed. In fact, I know one that had breast cancer and breastfed. She deferred her chemo, which I would never recommend, but she did it. She deferred, which means delayed, the chemotherapy treatment so that she could have her baby breastfeed, whatever. So that's just a side note. So I hope this helps. All right, now, I'm going to get ready to do this quiz. I gave you this video. I gave you the answers to the quiz. I'm going to get ready to do this video. Stay with me.